Hey guys, welcome to Avoiding Pitfalls and Penalties in Transitioning to Medicare. I'm Danny Ratliff here with Richard Rosso. Take care of a little housekeeping. We have to get to these disclosures as usual. We are Clarity Financial, doing business as RIA advisors. We are a fiduciary. So take this as informational, educational. We're not giving any recommendations here, but lots of information to get to that I think you guys will all benefit from.
Yeah, so who provides health insurance in the United States, Danny? Well, most of the time, we receive our health insurance through our employers. So that's the big silo right there on the left. But when you leave your job, you move to one or the other silos. And most likely, it is going to be Medicare. Or if you retire before 65 years old, you're going to move into the individual health insurance silo as well. So you get to see a whole new system of how healthcare works. The key is the transition from employer, for most of us, Danny, right, to Medicare.
You know, Rich, it's not as easy as most would think. And it's, this is typically one of our more well-attended webinars because there's so many moving parts. It's the alphabet soup of healthcare. When do you enroll? So we're going to cover a lot of information today.
Yeah, first you want to make sure that you make a smooth transition from your employer insurance to Medicare. You want to either, one, most important, Danny and I will talk about avoiding these late enrollment penalties and avoiding coverage gaps. And then you want, if you have to, say you're going to retire before Medicare, you're going to secure adequate coverage with private insurance. You also have to fill Medicare gaps because what Danny and I always talk about is when you get Medicare Basic A and B, or what we call original Medicare, you are getting a slice of Swiss cheese. Swiss cheese has holes. You have to fill in with private insurance where Medicare lacks, in addition to prescription drug coverage, which is called Part D.
So second, you'll want to understand your first year healthcare cost. So while you're working, your insurance premiums are being subsidized currently by your employer. If you pay a portion of those premiums, they're coming directly out of your paycheck. Now, so you may be really unaware of how much you're paying many times. That's going to change. Once you retire, you're going to be on your own. And so you will have to pay for those Medicare premiums, at least Part B, Part D, and any supplemental policy that you may have.
Now, your issue 3 is to plan for lifetime health care expenses, including long-term care. So as you age through retirement, your health care costs continue to rise, and you might need more care as you get older. So it's going to be important to plan for these higher costs. The amount you budget for health care in your first year of retirement will probably go up in the years ahead. Like, Danny, what we do with our financial plans, right? We have a specific inflation rate that we track and monitor for healthcare expenses, not only for Medicare, what you're thinking, but you will also have, as you age, out-of-pocket costs. And we make sure that we help you plan for those.
So now we're going to talk about how do you tackle these issues. So we're going to look at the agenda for today. First, we're going to talk about how Medicare works with the employer insurance. We showed how Medicare in its own separate silos from employer insurance. So it is a transition. It's something that's, somewhat difficult for some to understand. Second, we're going to talk about who needs to enroll and when. There's a lot of misconceptions about this, and I think that we want to make sure that this is one of the issues that you do get right. How to enroll in Medicare. Medicare.gov is the typical site that you will be, getting a lot of the information from. We do have to be cautious as there are other websites that do look very similar. Then how private insurance works with Medicare to provide that complete coverage. And last, how much you can expect to pay. Now, this is something that does catch a lot of people off guard. So like we just discussed, budgeting for this, understanding the overall cost and the impact to you and your financial plan.
So number 1 is how Medicare works with your employer insurance. Listen, today, most people are working past 65, and there's nothing really for you to do yet, for the most part. You'll simply continue with your employer plan, and you're not going to enroll in Medicare just yet. Again, you're not eligible for Medicare until age 65 if your employer has 20 or more employees and it's deemed a creditable plan, you don't need to do a thing. People think, Danny, that they have to do something because, oh, I'm 65, I've got to do something. Not necessarily.
So if you are working and you're under 65, you're going to continue with your employer plan, and there's not any Medicare yet. So remember, the big thing here with Medicare is you can't sign up until you reach the age of 65. Now, if you are under 65 and retired, still no Medicare, but does your employer offer a retiree plan, or your former employer, or can you get on spousal coverage? Now, if not, you'll have to go out on the secondary market and find insurance for yourself. Which, Rich, this is one of the things that we see that blows up a lot of financial plans is the actual healthcare premiums just leading up to Medicare. It's a lot more expensive than I think most people realize.
It's the old Abbott and Costello, who's on first. If they were doing Medicare, it would be who pays first, right? So you got to keep in mind, this table's helping you to understand how your health bills get paid. Right now, while you're working, your doctor sends your bills to your group health insurance plan and they get paid. When there are two insurance companies involved, such as a group health plan and Medicare, there is a primary payer and then there is a secondary payer. The primary payer pays up to its limits and then the bill is sent to the secondary payer. So if you're still working and you're covered by an employer health plan that covers 20 or more, the group health plan pays first. If you're also enrolled in Medicare, and if its bill is not fully covered by your group health plan, Medicare will pay its portion up to the limits. But here's what's important about this table. If you're covered by a health plan that covers fewer than 20 employees, or if it's a retiree plan or COBRA, Medicare pays first, and the other plan pays second. But in order for Medicare to pay, you must be enrolled, obviously. So if you aren't, your other insurance may not pay its share. So in other words, if you should be on Medicare and you're not, your prioritization or coordination of benefits is going to get complicated. So keep in mind, most people at 65 are still working. Many are covered by 20 or more employees. But there are times, Danny, where your employer might say, hey, sign up for A, right? You may still be on Medicare, even though you may not need to be. So it's very important whoever you work with understands these coordination of benefits when you're 65 and still working.
So let's talk a little bit about who needs to enroll and when. I think this is a big deal, and this is one of the issues I think that many people either get misinformation or it's overlooked.
Yeah, it does. It's people even get confused by the age, because when Medicare came out in the 60s, 65 was this magical retirement year. Not that way anymore.
That's exactly right. So if you're under 65 and working, there's currently nothing for you to do at the moment. So you're covered under that plan, your employer plan, and you're not actually even eligible for Medicare yet because you have to reach that 65 years of age. If you're under 65 and retired, now this changes things a tad bit, but you're still not eligible for Medicare. So you can do a couple things. Your previous employer may offer a retiree plan. A lot of times we're seeing that people do have that available. We also know that if your spouse is still working, many times you could get onto their plan. If that's not an option,
could be a life-changing event. You don't have to wait till open enrollment for, say, November enrollment period time.
That's a very good point.
Right.
And then the alternative would be to go to your state's insurance exchange and see if what you qualify for. You may get a subsidy, you may not, just depending on what your income is. So now, Rich, this is where it starts to become much more difficult in the sense that when you do reach 65, now there's actually some moving parts on Medicare, what parts you should sign up for, and when, and if your employer may even actually require you to, right?
Right, because we find that majority of people are still working at age 65. So there's most likely going to be this coordination of benefits. So if yes, you can stay on the employer plan and delay Medicare, right? However, you should talk to your benefits administrator to see if you should enroll in any part of Medicare. You may be advised, we had mentioned this earlier, to enroll in Part A because it's free and generally offers better hospital coverage, believe it or not, than most employer plans.
So, Rich, this is my favorite investment vehicles, the HSA.
One would say Danny has an HSA fetish.
I do like HSAs because, look, they are one of the best investment vehicles in the world if used properly because you get the triple tax benefit. However, if you're going to sign up for any part of Medicare, you're going to have to stop your contributions to an HSA 6 months prior. So now you may be on a high deductible health plan currently at work. Utilizing the HSA, you may decide, hey, I want to switch over to a different type of insurance at work. Usually that's only done during that open enrollment period. However, just make sure that you stop any of those contributions prior to that 6 month period because this could throw you for a little bit of a loop.
Mm-hmm. Now we're sort of going to go back to our question, if you are 65 and working. Does your employer plan cover 20 or more employees? If the answer was yes, we saw that you can delay enrolling in Medicare, but you should talk to your employer benefit administrator. What if the answer is no?
So if your employer plan covers fewer than 20 employees, you need to enroll in Medicare at age 65 to have complete coverage and to avoid those costly penalties. So remember the table we saw earlier of who pays first. So if you're over 65 and covered by an employer plan that covers fewer than 20 employees, this is where Medicare will actually pay first. But what if you're not enrolled in Medicare? That's going to be a big problem.
Okay, so number one, you have to enroll in Medicare if your employer plan covers fewer than 20 employees. I've had some people that tried to say, well, I don't want to. Well, you have to. Okay?
Yeah.
Also, you want to talk to your benefits administrator because your health insurance at work could be different. Unlike the insurance you had before age 65, your insurance now is going to be coordinated with Medicare. You may want to keep the employer plan for supplemental coverage to fill in some of the gaps that Medicare doesn't cover. But since Medicare is going to be your primary payer, you're going to need to enroll in Parts A and B. Part A covers hospitalization. Part B covers doctor's bills and procedures. Drug coverage works a little differently. If your employer plan offers coverage that is at least as good as Medicare's, called what we call creditable coverage, you can keep that plan for your drug coverage. And you don't need to enroll in Medicare Part D. Your insurance company is required to give you a statement. This is very important. Each year, certifying that the plan is creditable. As long as you have that, you can delay enrolling in Part D. You will not be charged a late enrollment penalty if you enroll later. If you ever lose your employer drug coverage, you should really not go more than 63 days without coverage, because if you do, you might be charged a late enrollment penalty.
Okay, so we've given you the basic rules on when you need to enroll in Medicare and when you don't, or when you can. So specifically, if you're 65 and working and your employer covers, your group plan covers more than 20 employees, you can stay on that employer plan. You typically will not have to sign up for Medicare or enroll in it. However, our advice is to anybody that's 65, call Social Security Administration. Make sure you ask them if you need to enroll in Medicare. And this is going to be really important because you want to make sure that you are on a creditable plan. And you also want to document your conversation. So if for some reason you get information from HR, from an insurance agent, whoever it may be, and they give you misinformation, there's no recourse. However, if you're talking to Social Security Administration and they give you bad information, I'd want to know exactly what time your call was, who it was with, document their name, what number you called, and as many details of that conversation as you can. So if you come back to Medicare and you're not working any longer and they say, hey, you weren't actually on a creditable plan, you can say, hey, I talked to so-and-so and they told me I didn't have to. At that point, you may have some recourse in the sense that you're not going to be charged these penalties, which we're going to talk a little bit more about here in the coming slides. Hey, so I know we have a lot of moving parts here. We're getting into this information rather quickly. If you do have questions, don't forget, you go to the chat. We'll be monitoring that as well. We'll try to get to those as we progress today.
So I want to talk a little bit about penalties. This is very important. If you don't enroll in Part B when you're supposed to, you will pay a 10% penalty for every 12-month period you haven't been enrolled. So let's say your Part B premium is $170.10, and you pay a 10% penalty. So your premium this year will be $187.11. If premiums go up next year, you'll pay that premium plus 10% of that amount, and so on for the rest of your life. You don't want to pay this late enrollment penalty. That's why it's critical to get SSA's guidance when you turn 65. And Danny, how many times we see people that do this and they go, well, I'm going to try to fight it. You can try, but I will tell you, it's close to impossible. I have yet to see anybody that has battled this and was able to get the penalty removed.
Yeah, I think I've heard of one person. There's other things that you can battle and appeal for with Medicare. This is not one of them. So we saw that earlier table that COBRA pays secondary to Medicare. But I want to bring this up again because it is quite common for employees to go on to COBRA. And this is a big, big misconception. So somebody goes and they retire. You have COBRA for 18 months after leaving your employer. And you kind of consider it that if you were working for a creditable plan that had 20 or more employees, you think it's just an extension of that plan. And I've even heard some HR reps tell people this as well. Here's the kicker. You don't enroll in Medicare within an 8-month period. This will be your special enrollment period. You're after 65, you retire. You're going to have a late enrollment penalty. And so this is for every 12 months. So some people have come off of COBRA after 18 months and found that they couldn't go on to Medicare right away. And this is an issue because now you have to wait until the next general enrollment period between January and March. So you could spend quite a bit of time without health care insurance. So, and then you must consider that the next time that coverage starts in July. So make sure that you don't have this large gap. This is something that we do see from time to time, and there's lots of misinformation out there about that. So if you go on to COBRA, you're over 65, you have that 8-month window. Make sure you sign up within that 8-month window, or you could be faced with some issues and have a large gap.
Now listen, we know these enrollment in periods are confusing. That's why you want to talk to us, talk to your financial advisor, talk to your benefits administrator. You want to have these discussions. When you know there's going to be a life change, especially with dealing with health insurance, you want to talk it over, because even for us, we know these enrollment periods. But Danny and I always say, my gosh, how does just everybody who doesn't study this stuff deal with it? It's not easy, and thus you know why people get subject to penalties. So, okay, so now that you're clear on whether or not to enroll in Medicare and when, we're going to talk about how to enroll in Medicare.
So really, enrolling is pretty easy. Now, we talked a bit about, medicare.gov. That's the website you'll want to go to. You'll actually go click on Get Started, learn more about Medicare, and it'll walk you through the process. But this is where I'd encourage everybody to be extremely cautious, because if you Google Medicare, you'll have medicare.com, you'll have medicare.com, medicare.org, and obviously the one we want to use is medicare.gov. They all actually look very, very similar. Some are trying to sell you stuff.
It's pretty sneaky, because when you type it in, like whatever that's prominent, and it looks like the medicare.gov site. If I would do this, I would just go up to your bar at the top of the computer and screen and type in .gov, because you can be very confusing, because a lot of these sites look like medicare.gov.
Yep, that's exactly right. So when you're going to enroll, another thing that you need to consider is if you're already taking Social Security and at 65, you're going to automatically be enrolled in Medicare Part A and Part B. So you can decline this if you wish. If you're on that creditable plan, 20 or more employees, most people will decline to start Part B. Part A, you've been paying for that throughout your working career through payroll taxes. So you can decline Part B, keep Part A. And in fact, there are times that your benefits advisor may tell you to go ahead and go ahead and sign up for Plan A, because typically it's going to cover a bit more than your your employer benefits will.
Right. Now we're going to talk about how private insurance works with Medicare, because remember what we said. When you enroll in Medicare, original Medicare, you're buying Swiss cheese. Now we're going to talk about how to fill the holes.
Okay, so even though Medicare is a government program, it is based on the private insurance model. So it is a tad bit different because it's still going to involve deductibles, co-insurance amounts. It does not pay for 100% of your care. And so a lot of times people are surprised when they get there and they say, whoa, hold on. This is not what I anticipated. So keep in mind, you're also going to have Part D, so a prescription drug plan that's going to look, and it's going to be just like a private insurance company plan. So enrolling in Part A and Part B doesn't necessarily finish the job. You'll need to also consider if you need to sign up for Part D. And typically this is one of the other areas, Rich, that we see people not do because they say, I'm not on any prescriptions. I don't need it.
Right.
And what we see here as well is that, you discussed that penalty a couple slides back. That also pertains to Part D. And so the idea behind this is signing up at the right time, making sure that you don't have any gaps in coverage, and making sure you keep more money in your pocket because those penalties, those are permanent and those go on forever.
Yep. So here are some ways you can fill Medicare gaps with private insurance. First, you're going to look to see if your employer or retiree insurance works with Medicare. Some people have retiree healthcare plans, prescription drug plans that they can carry over. You want to see how that works. If so, you may just want to keep it. But make sure the drug coverage is creditable. That means it at least is as good as Medicare's basic drug benefit model. Your plan will know if it provides creditable drug coverage, and it'll give you a statement to that effect. If it's not creditable, which may be the case with some high deductible plans, you should find a standalone prescription drug plan on the open market. And remember, if you go more than 63 days without creditable drug coverage, you will pay a late enrollment penalty when you finally do sign up for Part D. If employer or retiree insurance is not available to you, you have two choices. You can take out a Medicare supplement policy, also what we call Medigap, which is what we favor here at RIA, and pair it with a prescription drug plan. Or you can enroll in the all-inclusive J.J. Walker, Joe Namath Medicare Advantage plan. Medicare Advantage plans are like HMOs for the most part, even though there are some PPO options that involve in the HMO a network of providers that deliver your care. But please note that whether you take a Medigap policy or you enroll in Medicare Advantage plan, you must still enroll in Medicare Parts A and B.
So this is a big conundrum for many people. So choosing between the Medigap policy and Medicare Advantage, it's not always as easy as it sounds on most of these commercials or mailers that you're receiving. Now, once you've made that decision, you actually have to go in and then decide which plan is best. So typically your employer's negotiated your insurance plans. Now you're going to have to go through and find out which one best fits your family's needs. So after you retire and you go into the Medicare world, you're historically on your own. Now, one thing that we always encourage clients and people we visit with to do is to find an independent healthcare broker. And really, I think this is important, Rich, because so many times somebody visits with somebody that maybe claims that that's what they do,
right,
but they work for one company. We want to go have somebody that can shop all the different ones out there.
Yep.
We also want to really understand Medicare Advantage versus Medicare. I know that, like you mentioned, there's a lot of big names out there promoting these things. One thing we've kind of said it's a rule of thumb. We advise people if they're giving you something for free to sign up, it's probably not really free. So these are things that you need to take into consideration. And when you look at Medicare Advantage plans, for instance, if you go into one, you may not be able to see the same doctor that you've had. Some specialists may not be available. A lot of people will use these to keep costs down. However, many of these are HMOs, so closed networks versus PPOs. Now, we have seen some things change with Medicare Advantage where they do have some PPO plans, but you still need to really, read between the lines and make sure that you understand if you're diagnosed with a serious condition that you may not be able to seek the care that you want from another provider or another institution. So we need to be extremely cautious and understand the limitations and the scope of what each one of these plans can and can't do.
Yep. Now, how much are you going to pay for your medications? So drug plans differ widely in what they will pay and what they require you to pay for different types of drugs. So when you are shopping for the drug plan, you're going to want to take your own drug regimen into account and see how much you would pay on each plan for the drugs that you take. Now, if you don't take any drugs on a regular basis, you can just go with the plan charging the lowest premium. You can always change it after a year. Most important, Danny, is that we get people that'll tell us, I don't take any prescription drugs, and they're proud of that, and I'm glad they don't. But if you think in your lifetime you're going to, you want to sign up at that Part D because you're going to get hit with the late enrollment penalty. I have one person that actually who had just gone to their doctor, and the doctor says, you're going to have a tendency to have high cholesterol. And I said, well, why don't you call your doctor and ask him what kind of drug you might be on in the next few months or next year. So she was even able to look up that drug just in case, because she seemed to have a tendency for high cholesterol. So sometimes, knowing your own medical history, knowing where you might have a pre-existing kind of situation that'll occur in the future, which is a terrible way to explain that. But hey, I have a tendency for this. Maybe I'm pre-diabetic. That's another way for you to do your homework.
Okay, so another consideration is, what are the monthly premiums? Medigap policies do tend to charge higher monthly premiums versus the Medicare Advantage plans, but you can't look at these premiums just alone because you actually need to understand, what's going to get you on the back end. What is your deductible? What's the co-insurance? What are any other out-of-pocket expenses going to be? So don't always think just because something's much cheaper on the front end that on the back end it's going to be the exact same way. Historically, that's not going to be the case.
So plans that charge lower premiums are going to have higher out-of-pocket costs, such as co-payments for each doctor visit, high co-insurance amounts. If you have to go out of network, very important to understand that. So be sure that you take into account all potential costs based on your own healthcare usage when you choose a supplemental. I think a lot of people, Danny, get seduced by zero deductible, zero payments, and they don't think they're paying it. Oh, I don't pay a premium. I don't pay anything. Well, come on. You're going to have much higher out-of-pocket costs. That's why you want to coordinate this with a planner, like us at RIA, that know Medicare or a qualified healthcare insurance broker, because nothing is free in this space. It's just how you use it and how much you're going to pay for it. So keep that in mind.
No, that's exactly right, Rich. I think that many people walk into retirement or age 65 and get onto Medicare not knowing, number one, a whole lot about it and the different caveats, but then the cost. I think being prepared to handling all of your own insurance in retirement it can be overwhelming for many. But then, unfortunately, many people retire without knowing how much they're going to pay in health insurance.
Yep.
And, we see all the studies, Rich, on, what the average costs that people spend on healthcare in general in retirement, 65 and older. I mean, HealthView Services, Fidelity, they all have different numbers, but the majority of them are $300,000 plus for a couple that's age 65 that they're going to spend throughout their lifetime. So we need to understand how it impacts your paycheck, what you're actually going to be bringing home. I think this is a big part of a retirement plan.
It is. So here are the items you have to budget for in retirement. And we do this as part of our normal holistic financial planning, right? First are your monthly premiums for Medicare and for whatever supplemental insurance you have. Second are your out-of-pocket costs for healthcare. That's deductible, co-payment, co-insurance, right? In other words, the gaps not covered by insurance. Some of the gaps left by Medicare can be covered by supplemental insurance, but not all of them. There also will be out-of-pocket costs for what we call non-covered services. So things Medicare and supplemental insurance don't cover at all.
Okay, so this next slide, this table here is what keeps some people up at night, because unfortunately, this is one of the things that many people don't take into consideration in retirement, is that if you make too much money, you can actually have your premiums will increase. And many times we see people, and if you've listened to the radio show or any of the blogs at realinvestmentadvice.com, one thing that we do have a tilt towards is talking about the accumulation phase is how do you accumulate funds in many different ways to help you get around stealth taxes. And this is one of the things right here that we discuss, and this is a big reason why. If you put all your funds into a pre-tax account, you take the funds out, you're going to be completely taxed. And let's say you retire. We've seen people want to buy a lake house, want to go check a bucket list item off, or their income is high. So this table here shows the Part B and Part D premiums for different income levels. So if you're single and your income's under $91,000, or if you're married, filing jointly, and your income is under $182,000, you'll pay the regular Part B premium of $170.10. There will be no income-related adjustment, or IRMAA is what we call it. Your Part D premium will vary, but if you pick a plan that charges the average premium, you'll pay $30 to $40 a month, give or take. So a total of $210. That's not too bad per month for Part B and Part D. Now, if your income falls into one of these other tiers, you're going to see your premiums are going to go up. So, for example, if you're in the second tier, you'll pay an extra $68 for Part B and $12.40 for Part D on top of your regular premiums. This will bring your total up to $290.50. Now, keep in mind, this is per person. So not just for you, this will be you and your spouse if you're married filing jointly. Your tax return. Now, here's the other caveat. They're going to do a 2-year look-back period. So if you turn 65 this year, you actually needed to start thinking in considerations on income when you were 63. Now, maybe you were working. There wasn't much you can do about that. There are some things that we can do. There's a form called SSA 44 that if you had a major life-changing event, you could actually potentially appeal. If you received a severance, you were let go, you could appeal this and say, hey, this was my income because I was working, or I did receive a severance package. Now, you're not always going to win these, and I see that many times, and Rich, you see this too, that a husband and wife go in to appeal this, and maybe only one of them wins the appeal and the other one doesn't, and they have to go back in again. I know it can be frustrating, but stay the course. You'll have to do this. If you're going to do it the first time you get on Medicare, you're likely going to have to do it the following year because remember, it is a 2-year look-back period for these additional premiums. That's right.
So to give you an idea of what you might pay for your supplemental insurance, this is a good slide for that. We've indicated some very typical amounts. $200 a month for your Medigap policy plus another $40 for your drug plan, or about $50 for your Medicare Advantage plan. You can find plans with fewer benefits at a lower cost, as well as plans with more benefits for higher costs. So choosing a plan based on your own expected health care usage is what you're tasked with at retirement. But if you want a ballpark idea of what you may pay for health insurance after retiring, you can plug these numbers in to your preliminary budget and then make your adjustments later.
So if you have a good supplemental insurance and your deductibles and coinsurance amounts and hospitalizations and medical services may be mostly covered, but there still may be some co-payments each time you visit the doctor or you get prescriptions filled. So things that you've probably already become accustomed to, you're likely going to have to continue with that. And then there's the services that Medicare doesn't cover, and that Medicare or Medigap policies typically don't cover either. And so this is one of the things that many people typically fail to account for. You're likely going to need to go get a dental plan, a vision plan. It doesn't cover hearing aids. A lot of times.
What'd you say?
Yeah, okay. Exactly, right? It also doesn't always cover alternative care. So it could be like acupuncture, chiropractors. These are things that a lot of people have grown accustomed to over the years that you may just not have the accessibility, or you're just going to have to pay for out of pocket. So keep in mind that some of the retiree plans could cover this. Your employer plans may cover this, but Medicare will not. Now, some Medicare Advantage policies will cover some of these. So it's going to be more all-inclusive, which can also be enticing to many people. You just looked at the premiums, Rich. You saw, Medicare Advantage was much cheaper, and a lot of times it does cover your A, your B, your D, and some of these additional services like the hearing, the vision, dental, all
cool
the things.
Fitbit watch.
Yeah, cool Fitbit watch,
Silver
maybe
sneakers,
a toaster oven.
You're getting all kinds of dynamite
That's right. That's
Frills.
exactly right. So just make sure you do incorporate those additional charges into your budget when you're doing your financial plan. Those things need to be accounted for as well.
I did go dynamite because I'm thinking everybody on this Lunch and Learn pretty much knows Jimmy J.J. Walker. Now, don't talk to your kids or grandkids about him because they're going to go, Grandma, Grandpa, you're crazy. You don't know what you're talking about. So here's a sample budget showing monthly premiums only. This is for an individual who is not subject to the income-related monthly adjustment, so they're just paying the base Part B premium of $170.10 per month. Their Medigap policy will be $200 a month, and the drug plan is $40. So that's your total of $410.10. So how does that compare to the employer insurance now? Is it lower? Higher? Some people save money after they go into Medicare, believe it or not. Others spend more. It just depends on how generous your employer was while you were working.
This next slide is a sample first-year budget, taking into account premiums and other out-of-pocket expenses. So this would be for a person who has the most comprehensive Medigap policy. There would be no deductibles or co-payments under this type of plan. Mm-hmm. So this has an advantage as well. But there would be those out-of-pocket costs that we just discussed for your dental, vision, alternative care, and any maybe additional miscellaneous cost. These costs will vary for each person. They can be higher. You may talk to your neighbor and it may be a little bit different for them than what you're paying. So keep these in consideration and, understand what these costs are going to be in retirement. So if you're, a bit ways away from Medicare, I would start to jot these numbers down, start to get a really good understanding of exactly what the impact may or may not be. Rich mentioned within the plan, our financial planning tools, we do utilize and actually add these to this. We like to actually separate these healthcare costs from our other expenses because we know that if you look at healthcare inflation, it's generally much higher than all the other inflationary pressures that we see.
I don't know if it's more than eggs now. Inflation on eggs and meat. But to Danny's point, generally speaking, healthcare inflation has generally been higher. If we have to adjust these numbers toward the end of the year, beginning of next year, inflation is something we track very closely. We certainly will. So now, very important, I know everybody on this call is in a different place with regard to retirement. Some of you will already be retired. Others are planning ahead. The first step is to determine your Medicare effective date. This will either be the first of the month you turn 65, or if you're still working and covered by that employer plan that covers 20 or more employees, the month you go off the employer plan. Most important is we don't want you to have a gap in coverage as you transition.
The biggest question I think we receive is when do we start shopping for a Medicare plan? Let's say you've already retired, you're reaching that age 65, that birthday's coming up. You're going to have a window. So you have a 7-month initial enrollment period. And so that's going to be 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after. So we like to get the ball rolling, a couple months prior. Go ahead and start doing your research. Understand exactly, okay, you need to sign up, or maybe you don't because you're working. You're still working on a creditable plan. Mm-hmm. But one of the big things here is that you need to understand Part A, B, and D, and or Medicare Advantage, and make sure that you have a really good understanding as you go to sign up for this. And be cautious of all those things like we just talked about, that you're going to have to get some of these other types of insurance a la carte. You're going to have to pay for some of these things on the side. Now, if you've continued to work and you're going to have you're going to have another window that's going to be your special enrollment period. And so you have an 8-month window from the moment that you stop working from that month if you're over 65.
So once you make this transition to Medicare, you think your job's over, but Danny and I know it's not. Some of the care plans change every year. Medicare Advantage plans change their pricing and their terms based on the outlook for healthcare costs in the year ahead. I have a client that goes through every October through December, goes through his Medicare Advantage plan, or something changes. He puts homework into this. you're going to have to do the same. They might raise their premium for Medicare Advantage, kick your doctor out of the network. You have no more silver sneakers. It's just not as dynamite as a new plan, right? So it's very important if you have a Medicare Advantage plan to review the materials when you receive them in the fall, see if there are any changes, make your decision between October 15th and December 7th of each year as to whether or not you want to stay in the plan or change. So if now, different, if you decided to go with a Medigap policy, that policy itself is not going to change, but the drug plan that you choose to go to with it might absolutely change. They might start charging you a different amount for the current drug you're taking. You want to review the drug plan materials. Maybe you're on a new drug and you got to make a change. A lot of older Americans overpay for their Part D coverage. There are many studies out there that show this, right, Danny?
There's a ton. And so, in fact, that's why, what you mentioned was shopping this each and every year. The average person that's on Medicare, what is it? It's several $1,000s that they typically lose out on by not shopping the plan on a regular basis. So we do encourage shop that each year. If you're on new medication, that's another big point there. Don't leave any money on the table. So today we've talked about a lot of different things. So, number one being the enrollment periods, the different types of Medicare between Medicare, original Medicare and Medicare Advantage, if you need to enroll or if you don't. I know there's some moving parts here. If you have any questions, don't hesitate to reach out to Rich or myself. We'd love to visit with you guys. Make sure you understand these things because we don't want you faced with a permanent penalty. We don't want you having a gap in coverage, and we certainly don't want you, on something and spending too much for something that you don't technically need. So this is going to conclude our presentation today. If you have any questions, don't hesitate to reach out. As always, go to realinvestmentadvice.com. A conveyor belt of information. You can also type in Medicare. Rich has written some articles on that. I have some previously, probably been a while, but there's going to be a lot of information right there, and we'll keep you guys posted. And let us know. There's going to be a brief survey after this event. Let us know what you'd like to hear more of. We love getting information back from you guys as far as what's important to you. Also, if you'd like to schedule a visit with somebody, we're going to give you the ability to do that right then and there. So thanks for joining. We'll see you guys next time.